Hello. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Johnson, and I'm waiting on people to join us. It is late this evening in Indianapolis. So, like I said, we're just waiting on some people to join. Regardless, if you want to share this screen, just press the share button at the bottom of the screen. And if you have a friend who you think could benefit from this talk today, just tag them. Oh, welcome. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist, and I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on Facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. We're going to continue our lecture series on common everyday practices to unmask your beauty. And today we're going to talk about chemical exfoliators. As you recall, last week we discussed mechanical exfoliators and then what is the job of an exfoliator. And as you recall, the job of an exfoliator is to help get rid of dead skin, to unclog the pores. If you have acne, it will help loosen up, again, the dead skin. So therefore you can alleviate the clogged pores that's causing those white and blackheads. Also, it will help with keeping you youthful, help with fine lines and wrinkles, and some other things also. So today on chemical exfoliators, these are products that actually loosen the bond between the cells. And that's how they work, unlike mechanical exfoliation. So your three major groups are acids, common alpha hydroxy acids. Number 2 is enzymes. And number 3 is your retinol. So as far as chemical exfoliators, such as your alpha hydroxy acids, there's also include your lactic acid, which is a milk acid, your glycolic acid, as well as salicylic acids, and also trichloroacetic acid. And I think I mentioned the glycolic acid. Well, regardless, all those products will cause exfoliation by loosening up the cells, the substance between the cells, the bond that holds the cells together. And what one will notice after you use these products is you're going to have some sloughing or you will notice dead skin. But on microscopic terms, it's actually exfoliation or your skin is peeling. And some people will notice more peeling compared to others. Other people may notice a lot more skin sloughing or a lot of big sheets of dead skin peeling off. And that is fine. Everyone responds a little differently. If you're the type that don't want that to be noticed, then tell your esthetician or whomever is doing your chemical exfoliation so they will start very slowly and progress in concentration of the product. Now, what you can do to alleviate the exfoliation or that if you have a lot of dead skin peeling is to use a heavier moisturizer for a couple of days. And that will not clog your pores to cause any problems, but it definitely will help hide the peeling that you're experiencing. Now, one common problem with exfoliation using acids is how long do you keep it on? Every acid is different. So the lower the concentration, you keep it on a certain amount of time. And of course, as you get higher in that concentration, you should be building up tolerance to it using that product. But again, this is something that you should go to a professional for, not something you should do at home. I've seen a lot of people trying chemical exfoliators using the acids at home, and they're in my office with chemical burns. And that does happen, and it's not worth the adverse reaction you're going to get by doing something to them. So, but with the acids, I know for our glycolic acids, the type we use, we leave it on for 3 minutes and rinse it off, and no one really have a problem with no one has a problem with burning. But also as far as with the exfoliation, the peeling of the dead skin, again, everyone is different. Our acids can go anywhere from 5% up to 70% for glycolic acid. But again, depending on who you see and what they are using, every acid is different. Trichloroacetic acid goes deeper, so therefore it's going to do a much better job with exfoliation. And we use it to help with brown spots, to also help with the discoloration besides anti-aging. So brown spots meaning age spots. And then for discoloration, for people who can use that particular chemical, not everyone can, we use that also to help with discoloration such as melasma. Again, that's not something you can leave on a long time, but for with trichloroacetic acid, I also use it for my patients who have precancer spots, and it really does a good job of cleaning up the area and giving a nice touch of an aesthetic touch. So, but as far as your your chemical peels, such as your TCAs and glycolic acid or your alpha hydroxy acid peels, you want to make sure you do not leave the product on too long. And yes, you will have some exfoliation. Yes, you will burn. A lot of times you neutralize it with water, but again, depending on the chemical and where you're purchasing it from, they will tell you what will neutralize the product. And do so, and like I tell my patients, do so until you don't feel anything. So after you rinse it off, you should not feel any tingling still. If you do, that product is still very much active and is still working. So you want to make sure you rinse it off very well, and then put on a moisturizer if you need so. And after a couple of days, you will see the results of your efforts. As far as the second group, the enzymes, I see a lot of estheticians use those, in which they actually go in and break up, again, the bonds between the cells. And we use ours to help with deep pore cleansing. So if you have a lot of red bumps, like your inflammatory acne, it does an awesome job for cleaning out those pores and those very large bumps that people tend to get with acne. But regardless, you can use that as an exfoliator also. And you really don't have much peeling as much as a feeling of just really deep cleansing that the enzymes does offer. And last, of course, is the retinol, which retinol we do not use and we rinse it off at the same time, meaning within a couple of minutes. Retinol is something you would do at home and you leave it on. So again, like I mentioned before, with retinols, you want to make sure that they are not too strong, because you can, as I mentioned before, can have an irritant dermatitis with that because it's too drying. And especially now that we're going into the winter months, you want to make sure you have a product that is suitable for you and not too drying. And again, this is the product that you only use at nighttime, not something that you put on during the day, because it can interact with the sun and cause problems. So you can find retinols mixed with other ingredients which you would purchase from your doctor or from a spa. But just keep it very simple, not to do too much when you're working with exfoliators. Again, you don't want to strip your skin of the lipid layer that I mentioned before, because it will dry you out and cause another problem that you do not want to have. Any questions for me? Okay, great. Well, again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist, and I help women who want clear and even skin tone with increased confidence. If that's you, follow me on Facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. And I will see you tomorrow around 6:30. Take care. Bye.